So this presentation is on intra-renal AKI by me, Luis, Ian, Fred, and then Eunice. So here we have Barbie, a 39-year-old businesswoman, scientist, farmer, journalist, and athlete that arrived at the ED with severe flank pain in her upper back with shortness of breath, heart palpitations, and tingling on her toes. Barbie said her symptoms began a month ago when she stopped taking her methotrexate for her systemic lupus erythematosus, and she noticed she began to gain weight, urinates less, and has had mild back pain, for which she took some of Ken's tramadol, ibuprofen, to help with the pain. Barbie has a history of coming to the ED for chronic episodes of dehydration and hypertension, and has been taking quinapril for the management. Barbie's initial symptoms began with weight gain, urine retention, and mild back pain, and she became concerned when she decided to seek help when her upper back pain became unbearable, had shortness of breath, palpitations, and felt tingling in her toes.
So, some of the labs that will be affected by intra-renal AKI, the first one will be the creatinine. This is the byproduct of muscle breakdown, and this will be elevated due to the poor excretions that is occurring and the lack of urine output that Barbie is having. She will also have an elevated BUN, blood urea nitrogen content. Urea is also a byproduct of protein breakdown, and like creatinine, this is because of the diminished excretion and lower urine output that is occurring during an AKI. Then this all affects the GFR, and this just shows us that the kidneys are not able to filter as well as they like to, and that the poor urine output leads to waste building up in our body, otherwise known as azotemia. So some of the other affected labs will be our electrolyte imbalances. So we'll have an elevated phosphorus and potassium level. This occurs due to the damage to the kidneys they have and are unable to excrete these electrolytes like they normally can do. It is also worth noting that due to the high phosphorus, calcium will be low since it does have an inverse relationship with it. We also will have decreased sodium. This occurs for two reasons. First being that since the body is unable to excrete the fluids, the body becomes hypervolemic and dilutes our sodium content in the body. And the second is due to the tubular dysfunction, that we are unable to reabsorb the sodium, leading to a higher excretion when we do void. Another affected lab will be on our CBC. We will have a decreased red blood cell count, and this is due to the fact that the kidneys won't be able to release erythropoietin or EPO like they normally can do, which is the hormone that regulates the blood making process in the body. So some of the symptoms that this patient is going to be feeling from these labs, first off is diminished urine production. During an intra-renal AKI, the patient will experience alterations in their voiding, leading to diminished output. And when they do, they'll excrete more sodium and less potassium and phosphorus, which can lead to our irregular heartbeats and irregular function of the body. This also decreased urine output would lead to, like I said, azotemia from the accumulation of creatinine and urea. And this accumulation can lead to mental changes in like fogginess, like confusion, and also full body weakness. Finally, due to our diminished urine production, we will become hypervolemic and develop edema, swelling, shortness of breath, because our lungs will be filling up with this excess fluid. And then finally, another problem that occurs from these labs is anemia. Like I said, we are not excreting erythropoietin as much, so we are going to have diminished red blood cells, and this could lead to problems like O2 saturations and perfusion being diminished, leading to shortness of breath, also confusion because our brain is not going to be receiving the necessary nutrients and oxygen it needs to function.
Okay, intra-renal issues. Intra-renal issues refer to the problem with the kidneys, which can lead to conditions like acute kidney injuries, or as we know it as AKI, or chronic kidney disease, CKD. While not solely related to heart health, these issues significantly affected as the kidneys help manage fluid balance, electrolytes, and blood pressure, as we know. Here's some nursing considerations and interventions for patients with intrarenal issues, which include nursing independent and collaborative actions. Okay, for our nursing considerations, which would be part of our independent, we can, for our first is we'll look at cardiovascular health. We need to look for signs of heart failure and other heart problems. Nursing considerations for respiratory issues. Oxygen therapy, we can administer supplemental oxygen as needed to maintain adequate oxygen saturation. We need to make sure we call the doctor to get that order. Nursing considerations for elimination are fluid balance. We need to, as nurses, we need to maintain strict I&O records to prevent fluid overload or dehydration. Fluid overload, like Ian was saying a second ago. We need to assess for signs of fluid overload, which is monitoring their weight, edema, and vital signs. Nursing considerations for neuro, we can inform our patients about the signs of neurological changes and when to seek medical assistance. We can also do vital signs monitoring. We can keep track of blood pressure, heart rate, respiratory rate, and changes in these can sign neurological stress. Nursing considerations, which is collaborative. Collaborative interventions for cardiovascular, we could consult our cardiologist and collaborate with the cardiologist to assess the risk factors and or health of our patient. We can collaborate with pulmonary rehab, and we can refer patients to respiratory therapy for exercise programs tailored to improve their lung function. Collaborative interventions for elimination, medication management from our doctors, work with pharmacists to adjust medications that affect renal function and urinary output, such as diuretics. Patient support, we can have collaborative interventions, provide emotional support and resources for coping with lifestyle changes related to elimination and their kidney disease. And lastly, we can have collaborative interventions for neuro. That would be an interdisciplinary team approach. Collaborate with nephrologists, neurologists to manage neurological symptoms associated with kidney functions.
Okay, so now we're going to talk about some of the patient education that we would be giving to some of our patients. First of all, we want to educate our patient, since Barbie has a chronic history of having dehydration episodes. It's to get her hydrated, to avoid becoming dehydrated and injuring her kidneys again. We also want to let her know that every time she does get dehydrated, she injures her kidneys, and they can take anywhere between 3 to 12 months for her kidneys to recover. So every time she has an episode of dehydration where she ends up in a hospital, she's starting back up from zero again. We're also going to want to educate with her about her dietary program to incorporate protein allowances, high calorie, low sodium, low potassium diet foods, because as Fred described, it's a kidney injury inside the actual kidney, so your body can't process a normal diet. So we're going to want to educate them on changing up their diet. We also want to let them know that it's really important for them to keep all of their appointments, especially with their primary care physician and their nephrologist, and any routine testing that they have to get done for their kidneys or lab work. Barbie is a chronic ibuprofen user, and we know that NSAIDs like ibuprofen can cause damage to your kidneys, especially with her scenario. So we want to educate her to avoid NSAIDs due to the already existing damage from her constant dehydration and her constant NSAID use. We're going to want to provide her a list of all of the prescribed medications, including the dosages, when to take them, how to take them, any adverse effects to report to their practitioner, whether it's the patient, the spouse, the caregivers, and then we want to give it to them in written form and verbally so that the patient can take it home and review it. As far as their diet goes, we want to let them know to cook with the spice instead of salt, because their kidneys can't handle the amount of salt that they're intaking because there's an injury to their kidney. So instead of using salt, use different spices to get their food flavor, because a lot of patients do complain about their food being bland. They don't stick to their diet regimen. Try to choose vegetable toppings such as spinach, or try to bake or grill meat such as poultry and fish. Try to eat foods without adding sauces or fats to it. Choosing foods with little or no added sugar to them. Recommend to Barbie that, to try to have activity for at least 30 minutes a day, keep a healthy weight and good diet, don't smoke, don't consume alcohol, don't do drugs, of course, and then have good rest and routine and sleep about 8 hours a day. So some of the short-term goals for Barbie, the most important one would be to restore her kidney function. That is usually the primary goal when you have any type of kidney injury, is to restore her kidney function back to baseline with having the least amount of complications possible for her. And Barbie's going to maintain her volume homeostasis by staying hydrated, increasing her oral water intake to prevent further kidney injury from dehydration. And then Barbie's going to introduce a healthy, low sodium diet that limits potassium and phosphorus so that she can help support her kidney function to avoid making her kidney injury worse. And that's it.